In this video, we will discuss a vaginal infection known as bacterial vaginosis. So, it is actually due to imbalance of normal vaginal flora. That is, there is loss of this lactobacillus bacteria. This lactobacillus produces lactic acid and makes the environment acidic, and therefore prevents the development or growth of these anaerobes. But when this lactobacillus is destroyed, then there is decreased lactic acid production and therefore overgrowth of anaerobes. These anaerobes are Gardnerella vaginalis. It is not considered a true sexually transmitted infection but may be associated with this activity. Risk factors: if they are having multiple partners, or when there is vaginal douching, or IUD device uses for contraception, or if female is a smoker, or when there is a history of previous bacterial vaginosis or low estrogen states. These all are the risk factors for bacterial vaginosis. Pathophysiology: as I have told you, when there is loss of lactobacillus, then the pH starts increasing. Normally it is acidic and it does not allow these anaerobes to grow because of this lactobacillus bacteria. But when it is destroyed, pH starts increasing and there is overgrowth of anaerobic bacteria. These anaerobic bacteria lead to production of amines. Amines are responsible for this typical fishy odor seen in Gardnerella vaginalis. What are the clinical features of this condition? Actually, patients see a thin, homogeneous gray-white discharge. Also, there is fishy amine odor because of amine production from bacterial vaginosis. There is fishy amine odor increased after intercourse especially. And we also perform a whiff test, that is KOH test, that also produces fishy odor. Pruritus, irritation are usually absent and mostly patients are asymptomatic. But these two things are prominent: grey white discharge and fishy odor, especially after intercourse. Diagnosis: there is EMSL criteria for the diagnosis of bacterial vaginosis. Normally equal to or more than 3 of the 4 criteria are required for its diagnosis. First one is thin homogeneous vaginal discharge, pH more than 4.5, positive whiff test, that is KOH is when used, then there is production of fishy odor because of amines produced by the Gardnerella vaginalis. And clue cells on wet mount microscopy. Clue cells, these are typical of bacterial vaginosis and these are mostly asked in the MCQs. Complications: there is increased risk of preterm labor if the patient is pregnant. There is increased risk of STIs including HIV. So, pelvic inflammatory disease is also a complication associated with bacterial vaginosis, but it is not so much associated with this. Post-operative infections. Treatment: actually this is an anaerobic bacteria, and mostly anaerobic organisms are destroyed by metronidazole. Metronidazole is given as 500 mg orally twice daily. Or metronidazole vaginal gel can be used if metronidazole is contraindicated, or clindamycin cream can be used topically as alternatives. But oral metronidazole is the best treatment option for Gardnerella vaginalis. How will you prevent or counsel the patients? Avoid douching, limit number of partners, and also protection. Recurrence is common. Retreat only if patient is symptomatic. So this is all about bacterial vaginosis.